The Northern Territory is set to announce a new plan to reopen today and has huge challenges with reaching vaccination targets. Live to Matt Cunningham in Darwin now. Matt, what are you expecting today?
Well, Laura, my understanding is that mandatory vaccination for almost all Northern Territory workers will be a key plank of what's being announced today. The government is expected to announce that it will make vaccination mandatory for any worker who is in contact with vulnerable people. Now, Aboriginal people will be considered vulnerable, and given that 30% of the Northern Territory's population is Aboriginal, that'll mean that just about everyone working here in the Northern Territory will need to be vaccinated. That will be done by a direction from the Chief Health Officer. It will mean that police, doctors, nurses, teachers, but also hospitality staff, pretty much every worker, you'd have to say 90% probably of the workforce here in the Northern Territory would fit into that category. So vaccination will be mandatory for them. We're also expecting the government to announce some further changes to the way it allows people to come and go from the Northern Territory. At the moment, there's a hotspot declaration system in place. Sydney and Melbourne, for example, are hotspots. People coming from those areas are forced into mandatory supervised quarantine at Howard Springs. There will be changes around that. They've already flagged bringing in a system where fully vaccinated people in the near future will be able to quarantine at home. My understanding is that from early next year they could go even further than that, that those who are fully vaccinated, regardless of where they come from in Australia, could just have to take a test and isolate, and then they'd be allowed to go out into the community. So we are expecting that announcement from the Chief Minister, Michael Gunner, in about an hour to an hour and a half's time.
Okay, Matt, thanks so much for that. What about vaccination rates? I mean, they're pretty low in some Indigenous community. That's got to be a huge concern.
It's a massive concern for the government, Laura. As we've been reporting this week, in some remote communities, particularly in Central Australia, the vaccination rates are as low as 6%. That's something the government's going to have to deal with. The big question it's going to have to resolve is whether it continues down its path to open up or whether it delays because of those low vaccination rates in some areas. Its target at the moment is that when it hits 80% fully vaccinated, it will open to the rest of the country, but the questions around whether it will be putting some of those Aboriginal people at risk if the rates are low. Now, my understanding is that the Chief Minister's message around this will be that vaccination has now become a choice. It's not about chance anymore, it's about choice. Everyone has had the opportunity here in the Northern Territory to be vaccinated. The Pfizer vaccine's been available to just about everyone for about 4 months now, so if people are not vaccinated, that is through their choice. There may be some measures that the government puts in place to actually lock down some of those communities, put biosecurity zones around them, as we saw at the beginning of the pandemic. But we are expecting all of this to be covered in that news conference from the Chief Minister, Michael Gunner, later this morning.